Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. A newly released Ipsos poll showed the Omicron variant has pushed COVID-19 back to the top of the world's list of what people in various countries worry about. Over a third of respondents said the virus was the biggest concern in their day-to-day lives. In fact, out of all the countries that were polled, people in South Korea worry more than any other country that was part of this survey.
And according to a report by Johns Hopkins University, cumulative global COVID-19 cases have reached more than 413 million and the death toll approaching 5.9 million. For more at where we stand globally in regards to the pandemic, we're joined by Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Good morning, Professor Cowling.
Good morning.
So despite concerns, Omicron is thankfully much milder than previous strains. And if other strains emerges based on what we know about the viruses, how viruses mutate, is it likely to be even milder than Omicron?
Certainly, I think we expect the impact of any future variant to be much less than the impact for COVID that we've seen in the last 2 years. I know in South Korea your case numbers are rising every day fast, but you will turn the corner soon. Within a month, I think case numbers will be coming down, further down than they are going up now. And so in the future, when there are new variants, even if it has the same level of severity as Omicron, it will not have as much impact in Korea, in other places in the world, because of the high level of immunity that's been built up from infections and also from vaccinations.
Okay, that's good to know. Now, I wanted to touch upon face masks. You're in the United Kingdom right now. All my family are in the UK. I know face masks are generally not worn that much, but in certain places they are still worn, of course. South Korea, we're expected to wear them pretty much everywhere still. I just wanted to pick your brains, really, with the data we have now. For example, if you're sat next to someone in the office for 8-9 hours straight with a mask on, or on a bus or on a train for an hour or so with a mask on, but that person next to you has Omicron, will a mask stop you contracting it? And at this point, is there any argument at all for maintaining wearing a mask outside?
Well, firstly, in indoor areas, I don't think masks will be 100% effective. But in an office full of people, if everybody's wearing a mask, then that means if there's someone there who's infected, that person's always going to be also going to be wearing a mask because everyone's wearing a mask. And that means you're going to definitely have a reduction in the risk of transmission and the reduction in the risk of a larger number of infections occurring in that office. So I think it's still a very good idea. Outdoors, there's never been very much COVID transmission. So I don't think there's a strong rationale for requiring face masks outdoors. But of course, if some people want to wear face masks outdoors, that's fine. I mean, I think people can do it. But I don't see a rationale for requiring face masks to be worn outdoors because it's not a location where COVID transmission tends to occur.
And Professor, South Korea recently started distributing the 5th vaccine, Novavax. And some people have now had jabs by different manufacturers. So I want to ask, is this practice common for other viruses and is it safe?
Well, for COVID, we have a number of different vaccine technologies. So we have the mRNA vaccines, we have the Novavax, which is a protein vaccine, we have inactivated vaccines, we have virus vector vaccines like AstraZeneca. What we don't have with other diseases is the use of vaccines from different platforms, other than maybe flu, where, you know, some children will get a nasal spray vaccine, some years maybe a jab, other years. For COVID, we have very good evidence now that there's no major concern with safety. We've seen a lot of people receive different combinations of vaccines. We're, of course, monitoring very carefully to see if there are any kind of more serious events occurring. Remember, we did pick up the blood clots after AstraZeneca jabs in Europe. So I'm not concerned about safety in that sense. And I think it's fantastic, actually, that we have so many different kinds of vaccines available and so many vaccine doses available for COVID.
Finally, now, we were told over and over again at the start of this pandemic, at least when the vaccines first came out, that getting as many people vaccinated as quickly as possible would eventually get us back to life as we knew it. But it seems here we are in early 2022, but life seems very much still like early 2020 when this pandemic broke out. Do you think sooner or later governments are going to have to adjust their strategy, perhaps thinking more about natural immunity, that spreading, rather than this endless stream of booster shots?
Well, I think in Korea, you're getting actually an awful lot of immunity right now in your population from infections. And I would say in 2 to 3 months' time, there will be most likely relaxation of the majority of public health measures that you have, because there will be no further justification for those measures when you're coming to the end of this Omicron wave. There's a lot of immunity in the population from vaccines, also from infections at that point, and no real need any further for the public health measures any further. In Europe, Denmark's already gone that way, UK's gone that way. So it's not so much saying that they give up, but simply they've done all that they can. They've made an effort. Right now in Korea, you have still public health measures in place to try and slow down the current wave. But as that comes to an end, let's say in 3 months' time, I really think that we'll see many countries, most of the world actually, deciding to transition away from the pandemic, no longer have too many public health measures.
All right, Professor Cowling, thank you for making time for us. Hope to talk to you again soon.
Thank you. Bye-bye.